today's East Jefferson Medical Moment, Camille Whitworth visits with Dr. Todd Englehart. He is a CVT surgeon at East Jefferson General Hospital. They discuss the many advances in minimally invasive cardiac care. Take a look.
Nowadays, if you have to have a heart procedure, it doesn't necessarily have to be done in a large operating room. There are now minimally invasive procedures that can be done here at East Jefferson General Hospital. Dr. Todd Englehart, CVT surgeon, tells us all about how far we've come.
I think for over 25 years now, vascular surgery as well as cardiac surgery and cardiology have tended to be more minimally invasive procedures. If the procedure can be done percutaneously, meaning through a needle stick in a radial artery or a groin vessel, then that's far preferable than opening the chest or doing a major open surgical procedure. And this has crossed all lines in vascular surgery and cardiac surgery. Now we're able to replace aortic valves percutaneously. It's usually done in a hybrid suite or in a cardiac cath lab with superior imaging, and that has revolutionized the way we think about aortic valve disease.
What's the advantage of a minimally invasive procedure?
There's a great advantage to doing these procedures because we work in collaboration with the cardiologist. As surgeons and cardiologists, we work together. We know a lot more about the disease process. We put our heads together, and I think having both disciplines benefits the patient greatly.
So no longer do we have to have the major heart surgeries like we saw back in the day?
Yes, I think that patients return to work more quickly with a minimally invasive procedure. There's less pain involved, and now we're seeing that the results are equal to the open procedure. We still have to wait for the long-term results to come back. We haven't been doing this very long time as we have data from open procedures. So the jury's still out on long-term data, but right now it looks very good.
Let's talk about the results. What are you seeing?
Well, the standard of care for many years has been the open procedure for the cardiac surgeon. So now we have a procedure that's done minimally invasive. We're getting great results. In fact, we're getting even superior results to open surgery. But if we can prove that these results hold up down the line 10, 20 years from now, then we'll know that it definitely is a superior procedure.
Who's a candidate for this surgery?
For aortic valve stenosis patients, a tight aortic valve may be a candidate depending on anatomic and clinical considerations.
Doctor, with more than 3 decades of experience, you have seen a lot over the years in terms of how we deal with cardiac problems.
I think there's been a natural progression to doing procedures with less downtime. In other words, patients can get back to work more easily if it's a minimally invasive procedure. And there's some remarkable advancements made on the industry side, allowing us to use tools in order to do the procedures endovascularly. I've seen over the past 30 years significant changes in the way patients desire this new form of therapy for obvious reasons. But saying that, I also believe that we still have to have the expertise to do an open procedure should complications develop, or should patients not be candidates for this minimally invasive procedure.
As we look into the future, what can we see in terms of advances?
Well, I think the mitral valve now is being attacked the same way. I think the mitral valve can be replaced percutaneously. We're seeing that. And who knows where else we're going with this. You know, it's just amazing.
So at the end of the day, it's about 2 things: safety and success rate. Let's talk about it.
I can tell you patient safety is of utmost importance. If we're going to try something new, apart from the standard of care, it's got to be safe. We also have to prove that the results are non-inferior, and in many ways we're proving now that the results of this new procedure are superior.
So if you're having an issue, it's important that you contact a doctor or physician so that they can treat your matters of the heart.
Thank you, Camille. As always, visit ejgh.org to learn more about this subject.